Hi, this is Assemblymember Rebecca Bauer-Kahan, the author of AB 988. I am so proud of the progress being made to make the 988 mental health crisis line a reality. Right now, if someone in crisis calls 988, they get immediately connected with a mental behavioral health specialist operating outside of law enforcement. This is revolutionary and will absolutely save lives. Indeed, we know it already has. A Cal Matters piece reported back in July that California's 90-day hotline had received more than 280,000 calls. Right now, we're on our way to making the other critical components of the 90-day system robust enough to handle California's sprawling and diverse population. The advisory group named in AB 98 to help advise the California Health and Human Services Agency on developing recommendations for the 5-year implementation plan is being formed as we speak. The input of the advisory group will be critical to creating a stronger behavioral health crisis system in our state. The first meeting of the advisory group takes place in December, which is just a month away, and I'm so excited that I've been invited to join that group. The California Health and Human Services Agency recently announced that Dr. An Tui-Bui has been named project manager of the 90-day crisis care continuum. Dr. Bui comes from the Department of Healthcare Services and has a strong background in mental health care, having worked as a community psychiatrist here in California for over 20 years. We will make good use of that experience as we have no illusions the 988 is anything but a massive undertaking. But it's a project whose time has come, and we have so many smart, passionate people working towards our collective goal of bringing all facets of AB 988 to fruition. On the legislative front, I was actively involved in this year's budget negotiations. I worked closely with the governor's office and our legislative partners to make sure we safeguarded the fund set up for 90-day activities, which prioritizes call centers and mobile crisis teams. Counties continue to be on the front lines, and the data we receive from them is key. In Contra Costa County, as most of you all know, our public health department has established A3, which stands for anyone, anywhere, anytime. This is an innovative approach to provide timely and appropriate mental and behavioral health crisis services to anyone in our county. Anyone that calls 988 will be connected with the A3 Miles Hall Crisis Center, where trained staff will determine the best and appropriate response. And that is a testament to all of your work and advocacy. So thank you to each and every one of you for being part of this incredible effort. In Alameda County, a call to 988 will route through the National Crisis Line. A trained crisis counselor will answer the phone, listen to a caller, and assess what level of support is needed. If a caller is experiencing a medical emergency, is in imminent danger, or in need of an immediate intervention, 988 will contact 911. Alternately, they can refer a mobile crisis team if the caller requires in-person assistance and one is available at that time and location. The long-term vision is to build a more robust and connected system that works for every caller. I also want to be sure everyone knows that when you call 988 from anywhere, there are options specific to Spanish speakers and for our veterans. For a deaf or hard of hearing ASL user, call 988 video phone, chat, or text 988, and TTY teletype users can use their relay service to dial 711, then 988. We are working to better understand the logistical challenges for mobile crisis teams in larger rural counties versus the experience in our more densely populated urban and suburban areas. While there is much to celebrate in terms of progress, I'm the first to remind folks that we are in the throes of a mental health crisis. There are not enough qualified mental health professionals to go around, and that is a countrywide shortage. I want to acknowledge that our prospective mental health professionals are waiting longer than usual to get their licensing and certification through the state board, and that's on us. We'll be looking to see if the governor's modernization proposal provides for more funding so the process can become more timely and get more mental health professionals out there serving our communities. But even with these realities in mind, I cannot help but be proud of the incredible progress being made on these life-saving programs. You have been a huge part of making this possible, and I want to thank you for your continued effort. Together, we can continue to work towards achieving amazing things for our communities. Thank you for your commitment and your hard work. I'm proud to be your partner in this extraordinary effort, and always in the memory of Miles Hall.